Hello, my name is Ruth Johns. I live in Missouri, and I was diagnosed with Alpha-1 Antitrypsin Deficiency at the age of 72 in the year 2002. I had never been to a pulmonologist or a doctor for what I thought was a sinus drainage and a chronic cough. It's easy to say, oh, my mother had this problem, and just let a simple symptom go unnoticed. I was extremely healthy, active, and busy teaching vocal music for almost 45 years, and also teaching swimming in the summers. Most importantly, I was a non-smoker and was seldom in a secondhand smoke situation. So by all standards, my lungs were pretty well taken care of. In 2002, while in a physical therapy facility for 5 days following my hip surgery, the alert and savvy therapists were concerned and very disturbed that my low oxygen levels were as low as they were. A series of tests were given and they all came back negative, except the last one, the blood work, and the blood test came back positive for Alpha-1 with a genotype of ZZ. My primary care doctor was astounded and perplexed, but he knew from his experience with 2 other Alpha patients that the only treatment for me, besides the oxygen prescribed by the therapist, would be the bi-weekly infusions of the protein Alpha-1 that I lacked. This protein is produced in the liver, and if we are deficient, we have basically a liver problem. As with other hereditary diseases, this lung disorder is a bit sneaky, elusive, and deceiving, with literally no symptoms. But along with this, there is the development or the risk of a COPD disease. This happens because the lungs are not being protected by the protein Alpha-1. All this reinforces the rule: get tested. You are the patient, and the medical field must honor your suspicions. You could say that I was asymptomatic, except for a little breathlessness in singing and the chronic cough for the preceding 8 to 10 years before I was diagnosed. It is critical that the pulmonary function test be taken, and especially a simple blood test for this hereditary Alpha-1 antitrypsin deficiency. This has not been the end of the line for me. I still lead an active, productive life, and with really arthritis at the age of 80, that's my main complaint. My family, my community, my church continue to be my focus. So my advice to all that are listening is to read all you can, research, and inform your doctor of your concerns. And above all, be your own advocate, and every time you breathe, breathe deeply. Thank you.